Hello, this is Jay Frost. Welcome to Frontlines of Social Good, the weekly news and views program from the Philanthropy Mastermind series. It's good to have you as always. We begin, as we usually do, with the top 5 gifts of the week, a roundup of the largest and most consequential philanthropic commitments around the globe, and it truly is around the globe this week. Then in headlines, political threats to nonprofit status, landmark court rulings affecting public institutions, and major funding decisions that could reshape the future of global health, environmental justice, and public broadcasting. Later in the program, we'll be joined by Michael Heblick, President and CEO of Contributor Development Partnership, or CDP, to talk about the implications of defunding public media and how philanthropy is stepping in. And we'll close with a conversation about the state of global health giving with Anil Soni, CEO of the WHO Foundation, and Bob Carter, one of its founding board members. We'll ask them what's at stake and what's next as U.S. funding for the World Health Organization comes to a halt. Let's get started. First, those top 5 gifts of the week in reverse order. Number 5, $50 million in Australian dollars, or 32.2 million US dollars, from the Ainsworth family to the University of New South Wales, funding the creation of the Ainsworth Endometriosis Research Institute to advance diagnosis and treatment of endometriosis. Number 4, 35 million pounds, or 46.75 million US dollars, from Inkfish to King's College London, establishing a pioneering research center aimed at improving maternal and child health through a human-AI partnership. Number 3, 100 million pounds, or approximately 133.6 million US dollars, pledged by the Buchman Foundation, funded by Igor and Anastasio Buchman, to accelerate research and development of new treatments for type 1 diabetes. Number 2, 1 billion RMB, or approximately 138.7 million US dollars, from Li Peng, vice chairman of CATL, and his wife, Lao Mei, to Fudan University to establish the Xiumin Natural Science Research Fund of Fudan University for cutting-edge natural science research. And number 1 this week, 150 million US dollars from the Kinder Foundation to Texas Children's Hospital and UT MD Anderson Cancer Center, launching the Kinder Children's Cancer Center to enhance pediatric oncology care and research. Now, here's some of the most important stories shaping the nonprofit and philanthropic sector this week. A provision in the House Republican budget that would have allowed the Treasury Secretary to revoke a nonprofit's 501c3 status unilaterally without judicial oversight or due process has been removed following strong opposition from nonprofit advocates and legal experts. Critics warned the language, similar to that in last year's HR 9495, posed a serious threat to nonprofit independence. While the current draft omits the language, observers caution it could return in future legislative proposals. Stay tuned for more on this in future editions of this show. Time magazine has released its first ever Time 100 philanthropy list, spotlighting those who are upending old models of giving. The list includes billionaires like Melinda French Gates and Mackenzie Scott, alongside organizers and activists unknown to many of us in the US, in the Global South, and individuals who have also been on the Philanthropy Mastermind series. Time notes the list was created not just to honor scale of giving, but to highlight people who are reshaping the meaning of philanthropy through inclusion, urgency, and systemic change. A federal judge has ruled that former President Trump's appointments to the board of the U.S. Institute for Peace were unlawful. According to the decision, Trump bypassed the statutory requirement to consult with congressional leaders, rendering the appointments invalid. This ruling calls into question the legitimacy of USIP board actions during that time and highlights broader concerns about politicization and nonpartisan institutions. In South Carolina, a federal judge has ordered the reinstatement of millions in environmental grants to 32 nonprofit organizations. The funding had been suspended in January following a political review of groups receiving federal support for climate and environmental work. The judge has determined that the freeze was illegal and that the government now must disburse the funds. The ruling is being celebrated in some quarters as a major victory for environmental justice organizations and communities impacted by pollution. Contrary to prior efforts to rebuild relations, President Trump has formally initiated withdrawal from the World Health Organization, as we've reported in recent episodes, and ordered the suspension of U.S. funding. This move marks a dramatic shift in U.S. global health policy and has raised alarms among health leaders around the world. WHO's Director General has just expressed in the last week his personal disappointment, and experts have warned that funding cutoffs could have lasting consequences for pandemic preparedness and global disease response. We'll be discussing this in greater detail in the latter part of today's program. President Trump has ordered the termination of all federal funding for PBS and NPR, escalating a long-running campaign against public broadcasting. In response, the Corporation for Public Broadcasting has filed a lawsuit arguing the action is unlawful and politically motivated. Local stations are responding with public appeals and emergency fundraising, warning that the cuts could shutter smaller outlets and reduce access to local news, education, and cultural programming. This unprecedented defunding of PBS and NPR has sent shockwaves through public broadcasting. And while national outlets may survive the blow, it's local stations, particularly those in rural or underserved areas, that could face some of the greatest risks. With federal funding suddenly gone, many are scrambling to maintain operations, staffing, and community services. In moments like this, public media turns to the people it serves and the donors who value its role in society. And to help us understand how public broadcasting can not only survive, but adapt and perhaps even grow, we're joined by Michael Hedlett, President and Executive Director of Contributor Development Partnership, and CDP supports over 230 public media stations in building strong, sustainable fundraising programs. He brings decades of experience in helping stations not just raise more money, but build deeper, lasting donor relationships. And as we begin and I introduce him, I have to tell him, I just saw yesterday an appeal you did personally at a station. It must be going back, well over a decade. So it was interesting to see you making those appeals in real life. And now you work with so many stations to do this. It's great to see you. Thank you very much for being here.
Thanks, Jay. Glad to be here. Yeah, I've been at this for about 25 years in public media. So I really care about public media and its mission. That's for sure.
Well, and in fact, you're somewhere right now where you're in the thick of it, not just your work with CDP, but also right there meeting with stations live and in person. Where are you?
Yeah, I'm actually in Atlanta. We're here for the PBS annual meeting with a lot of station leaders, fundraisers, content creators, educators. It's really a phenomenal crowd, right? And you can really feel the mission kind of pulsing through the hotel here.
Yeah, what's the mood like?
Well, it's cautious. I mean, everybody that works in public media is clearly fired up about the mission that we all deliver to the local communities, right? But the mood is serious, right? I mean, the threats to funding. This is not the first time that there have been threats to public media funding, but they're certainly serious, and I think they're making station leaders and station team members really figure out kind of how to tackle this, right? So yeah, the mood is serious. Somewhat, there's some optimism about the future. There is, but there is a lot of caution in the wind, right? And that's a big part of it.
Well, let's start with the big picture. I outlined it, but I may not have had all the facts correct, and I know you have them at your disposal. How would you describe first the scale of this as a crisis for public media, not just from national organizations, but also for the local organizations that you work with every day?
Yeah, I think that's the biggest part that you hit on, right? I mean, this kind of threat, first of all, it's kind of a multi-pronged approach, right? Because stopping or directing CPB, Corporation for Public Broadcasting, to not send money to PBS and NPR, it's just one of those, right? I mean, also going after board seats at CPB level, right? Going after looking at some of the FCC regulations around underwriting spots that are on the air. So there are like multiples of this, but the one part that you hit on, which I think is very true, this has very potential unequal effect across the country, right? Because in the end, we're talking about somewhat over $500 million a year, right? which is not the entire budget of the ecosystem of public media, right? But it helps support the stuff that is crucial, right? I think about it as like the plumbing, right? Kind of how the programs move around, right? I mean, some of the infrastructure and some of the infrastructure that is absolutely crucial, right? So you mentioned smaller outlets, and there are many communities around the U.S. that where public media is the only media, right? And just think about how much you are personally impacted by what happens politically. And I would venture a guess, I know it's for me, it's true. I'm way more impacted by the local government in New Hampshire where I reside and live than I am many times at what's happening in DC, right? And not having somebody locally cover those things, locally address those needs that media can kind of address in a community, that's a big gap, right? And when you look at some of the smaller public media outlets, right? I mean, significant portion of their budget is subsidized, if you will, it comes from federal funding, right? And so that's where the threat is more serious, and it really opens up a lot more conversations about first, how do we work? What is the role of donors in that whole kind of equation? But some of that is just simply irreplaceable, right? Because I think one thing needs to be clear. This is not we don't get to fundraise our way out of some of this, right? Not for every organization. There definitely the federal funding loss would be pretty hard hitting on many smaller communities, which I think in a way really threatens democracy when you think about it, right? Because not having a source of media, solid journalism, right, providing education to local communities, and even something as it sounds basic, but as warning systems during disasters, right? I don't think we want to leave communities kind of open up like that.
You just said a minute ago something that it's still reverberating in my head, which is it the only media. In some communities, the only media. How is that possible? For those who don't follow this like you do, it's 2025. How is it that that could be the only media outlet in a community?
Yeah. Well, I mean, think about it, right? I mean, this goes back to what we all care about, nonprofits, the mission, right? Doing something that filling the void that the regular commercial world kind of leaves behind, right? There is no point in many of the communities for normal other news outlets to open up shop, right? Because it just doesn't make sense. There's not enough audience, not enough advertising. The business model doesn't make sense. To me, this is analogous to what a lot of other nonprofits in the end up doing. They fill the void that is not filled by the commercial world, if you will, right? And there's still need in the society. And so when you look at, I just got back, I was in Montana, for example, this past week, right? And it's one thing if you're in Bozeman, but it's entirely another thing. That state is big, right? There are a lot of communities out there that basically they don't have regular reach to broadcasting because it just doesn't pay off to put up a tower, right? And so, and by the way, there are many examples like that, right? It's natural to think I say Montana, you probably think Wyoming or others, but think like, parts of Tennessee, for example, right? And other parts of the country that really are underserved when it comes to media.
There's another part to this, which I wasn't going to ask you about, but you've kind of raised it, which is about the importance of local broadcasting. And one example is, of course, emergency broadcasting system, which is critical. I think we all understand what that would mean if we didn't have it. But maybe broadly, what is the importance of having local, let's say, reportage or locally based programming? Why is that important?
Yeah. Well, I think about it through two lenses, right? Because public media is really composed of traditionally radio and TV, and a lot of digital content, etc. But when you think about to its roots, a lot of it has to do with broadcasting, right? And when you think about public radio, that's where a lot of the news focuses, having local reporters, right? I think that matters to cover what's happening in a local town hall. That's how your tax dollars are spent, right? Uh, holding people accountable that are in the government. I think that's super important, and having that as an independent journalism, right? Very important. And there are many areas in the United States that would be called news deserts, if you will, right? Because local newspaper got shattered and bought up and broken up, right? And all of a sudden it's a regurgitation and rebroadcast of national news that is not as relevant all the time. You need somebody going to the local town hall, right? So, but journalism is one part of it. The other part is also local education, right? When you look at what PBS delivers to communities, the service to kids, right, is tremendous. making sure that kids learn to read, count, right, and many other skills. There's really tremendous amount of content that comes out into those communities. So I think about it both as kind of journalism, education, right? I mean, it is it is when you think about the mission statement of most public media organizations, right? It generally has three words: educate, inspire, and entertain, right? And and all of those things matter, right? So anyways, I think about it as journalism, but also as kind of this educational mission that we all have.
And just to put a fine point on it before we move on to how people are responding, what are some of the immediate risks that stations face? I mean, are they layoffs? Are they programming cuts? What does federal funding mean to them?
Yeah, I think that's it, right? I mean, one of the immediate focuses is, for example, the federal funds for Ready to Learn program, which was focused on educational programming, that was curtailed a few days ago. And we're already seeing that kind of going through the system, if you will, because stations simply had to kind of cut back, right? They just won't have enough funds to kind of keep everybody. So yeah, I would think that some of those cuts, right? I think the other part of the response is uh, you do have to at that point revisit any part of efficiency and collaboration that you can, right? So what I'm seeing is a lot of folks kind of huddling together and figuring out what are, if two stations can come together and work together, right? Which is not a trivial process, right? But you see a lot of those conversations kind of being explored, so kind of driving even more efficiency, which, if you ask me, I mean, that's a good thing. That's something that we should be doing all along, and we as public media have been doing that, right? I just think this puts a different level of urgency on those conversations.
Well, I know that people talk about this with all sorts of businesses or organizational types, which is how much can you cut your way to success versus how much, do
Yeah.
you need to grow in order to succeed? And so on the fundraising side of this equation, moving away from the efficiencies for a moment, what kinds of things are we talking about? Emergency campaigns, public appeals, outreach to major donors, or is it all the above? What's happening?
Probably, yeah, a pinch of every single thing, right? I mean, we've certainly started putting out some messages, right? But I think it's really important. I said that earlier, right? That I don't see how we can kind of fundraise our way out of some of that infrastructure change that just would be lost. There are some things that would be just lost due to the cut in the federal funding if that happens, right? Uh, we've certainly seen donors respond and step up in last few days, but I also want to point out that right now as a system, we have not been focusing on fundraising around this message, if you will. We're mentioning it, we're using it in appeals, but it is not the message where we're kind of sounding the fire alarm, right?
Why is that?
Uh,
Is that because it's not effective or because there's concern that it would have some kind of negative like rubber band effect? Things would come back to you.
well, I just think that we also need to be truthful and to the donors, right? And it has not happened yet, right? I just want to be really realistic about it for a
Mhm.
second. It's a serious threat, right? And we do so. What we're asking for of donors in our communities right now is making sure that they sign up for campaigns like Protect My Public Media that basically make sure that you know who locally to contact, right? Which state legislature, which national legislators is kind of responsible for that vote on behalf of your community, right? So that's part of it. And then also acknowledging that there is a real federal funding threat and asking people to become monthly sustainers, asking major donors to step up. We are doing that, right? But but I think that it's really important when you're fundraising around a crisis that you're really honest with donors about what the crisis is, what the reality is, right? And and you don't start, when you have a hurricane in the Gulf, you don't start. Red Cross doesn't start fundraising before the hurricane hits. They start fundraising after it hits, right?
No,
So
it's very funny because on the other hand, that's exactly why we build endowments is so that we can be
yeah,
ready for the hurricane when it hits. But I understand your point. There's another piece to this, which is about donor fatigue. And if we were constantly asking, then there are some people who say, well, donors can get tired of those requests. I'm wondering if you
yeah.
find the same thing can be true of messaging, if you have to be careful about how you throttle that, because if you're really messaging the threat, in order to get people to be thoughtful, mobilize, aware, and potentially give, does that also run a risk of kind of message fatigue?
Oh, it does. 100% it does. That's why I think that it kind of has to be timed well. And I think that kind of that honesty and trust that we have with our donor populations is really important. It's not something you kind of trade away easily, right? So paying attention to how we talk about federal funding. It is a serious situation. It is. and we are communicating that, right? But we also, public media is tremendously lucky with high retention of donors. There's a lot of affinity. Once you are a public media donor, you're really loyal, right?
Mhm.
Very high retention of donors basically across the board, right? And so we want to make sure that we kind of maintain that trust, if you will, right? And when we really need them to step up, I think that's only one part of the equation, though, right? Is asking people to step up is one thing. Those are people that are already in your orbit, right? I do think that this is a new level of campaign that basically would bring in a lot of new audiences into public media, right? And new donor audiences. That's what we should be thinking about, because I don't know. I look at it. I kind of call it the library effect, right? Is you might not go to your local public library all the time, but I'm pretty sure you believe that it's good for your community to have one, right? And so same way with public broadcasting. You might not, turn on your television or turn on your radio every day, right? But you still likely believe that it's good for your community to have public media outlet. It's better for democracy, right? So to me, I think we'll eventually start finding out even more new audiences as well, that new donors. That's what we should be appealing. That's who we should be appealing to as well.
So is that something that stations can do or are doing right now, is doing donor acquisition in order to, and it may not just be donor
Mhm.
acquisition, maybe volunteer
Yeah,
acquisition or other kinds of,
yeah.
ambassadors to acquire new audiences?
Oh, 100%. I mean, through all the available channels, right? Of course, if you utilize the broadcast signal, then you are speaking to audiences that are already tuned in, right? But for example, I mean, digital advertising for sure, and certainly canvassing, door-to-door canvassing actually has been quite
Really?
quite fruitful, yeah. Because you essentially are all of a sudden at the doorstep of families with kids that grew up with public media, right? So we're seeing kind of younger donors coming in through canvassing in many markets.
Who's doing that
So
canvas? Is it staff or volunteers or some
uh,
combination of both?
the hired staff,
Yeah.
yeah, door-to-door fundraising, yeah. So those are just some of the channels, right? But it really opens up the community to supporting public media, where again might have grown up with public media and maybe got disconnected from it for a bit, right? So this
Yeah.
is a way to reconnect. But again, we're utilizing all different acquisition channels across the board, right? To always try to introduce new audiences. And I would say that actually local events, right? Because many public media organizations are community gathering places, right? When you look at some of the new buildings that like, if I look at last 5-10 years, right, of organizations, public media organizations that have updated their building, a lot of them have community gathering spaces, right? And that's a big part about kind of bringing the community together. And you see that literally across just about every station at this point, that there
Wow,
is some
that's
thought put into bringing communities together and having conversations.
and that's very much like the library model you just mentioned, because libraries have had to
Right.
transform in the age of
Yeah,
digital, and so there are community gathering places. They're places for kids
100%.
to do
Yeah,
things.
yeah,
So if it's, let's talk about this from a extremely practical perspective. There's a small station somewhere, which might be analogous to a lot of small nonprofits that are also going
yeah,
through similar, different but similar
yeah.
circumstances right now. Um, what might be some of the things they would want to have on their checklist to do in order to expand their reach, potentially drive some new donors into their coffers, but also just to be a good steward of the public trust?
Yeah. Well, I do think that for a lot, and by the way, I don't think that that size necessarily will dictate those actions. I think that what I'm about to share is kind of common across stations of all shapes and sizes, right? Is I think there is a great deal of efficiency that can be gained in fundraising, and I know that sounds almost like brutal, but there are a lot of donors that, as you know, right, that we can reach in very effective ways. And to me, it's respectful to the dollars they're investing in these institutions, right? Kind of finding the most efficient way. And that means collaborating with others, with organizations like ours and others, right? To basically drive efficiency into fundraising, making sure that that piece of direct mail costs as little as it can and drives the best kind of response rate, right? I would say then kind of understanding your local data enough that you know which relationships to invest in, because that's expensive time, right? Developing a major donor, mid-level major donor relationship, going after bequests, right? All of those things, that takes conversation, that takes local relationship, that takes kind of dipping into that community, right? So to me, refocusing internal resources of every nonprofit, certainly public media organizations, on building those durable relationships where you can, and making sure that you kind of drive the efficiency into fundraising on the other end, right? It's like it's the art and science of fundraising, right? The science, a lot of the direct response is more of the science, right? Making sure segments are tuned right and ask amounts are correct, right? All of those things. But then there is a lot of art behind fundraising, which should be backed up by solid data, right? Understanding your file, scoring it well, right? Understanding the capacity and propensity of donors. That's all important. But all of that points at best use of human resources at those nonprofits, right? Because you want that time to be spent on the most high yielding activity, which is building relationships.
Talk about your work through CDP a bit, because for those who are unfamiliar with you, either because they're not in broadcasting or just they haven't had a chance to work with you yet, what does it look like and how is it changing as a result of all this, if at all?
Well, you know what? It's in one way, it's amazing how it stays the same. On the other hand, how it has changed in just past few months, right? But the same, I'll start with the same, right? We started this organization with the purpose of growing net revenue, right? I keep talking about net to mission, right? Net revenue to organizations that can be focused on mission, not on fundraising expenses, right? And that has to do for us with gathering a lot of data across public media specifically, right? And understanding what are some of the practices that work best in one market that could also be transplanted across the country to others, right? And by the way, that is how we found door-to-door canvassing years ago, right? It was visiting Denver and wondering why the hell are they knocking on doors, right? It didn't make any sense to me. I thought it was too expensive and not responsive enough, etc. And the data showed us otherwise. And now we're doing that across multiple markets, right? But finding those little nuggets of things that are best practices that are proven by data and seeing how they can be transposed across the country, that is at the core of what we do, right? And that kind of demonstrates itself in many different ways, right? One is simply advising stations, hey, this is a good idea to do this. You have this opportunity in your file. You have this like large amount of, large number of donors that you should be talking to, right? Because that's what your data is showing as a gap. The other one is actually we've built a lot of services that actually help organizations do that, right? Where we can apply economies of scale, buy and negotiate at scale with other vendor providers that want to be part of the public media fabric, if you will, but a lot of times don't have the resources as vendors don't. Vendors don't have the resources to go talk to 800 organizations across public media. Some of them are simply too small, right? And then we have a lot of organizations that have partnered with us to actually run a large part of their annual fund so they can focus on the relationships, right? And that is where I would say kind of the biggest change has been in past few years, because it's that realization on kind of local public media organizations that things can be done differently and that you can refocus your resources, and that the only way to get to latest and greatest technology, for example, around marketing and kind of the marketing and communication tech stacks, right? And data modeling and other things is by working together. Because if we each kind of go and invest into that on our own, that's a lot of wasted donor dollars, in my opinion, right? When we can actually build up more shared infrastructure, right? And enable really the local relationship building. So that's, I don't know if I answered your question, but that's kind of how I look at it.
Yeah, no, you did. And you echoed something that you said in our very brief conversation before we went live, and just the sentiment that you have, which is you seem pretty hopeful. I mean, this is a crisis, but is this the old saw that every crisis is an opportunity, or is there something that you've been noodling on for a while in the same way that you kind of made that discovery that canvassing actually works, and that's how you were able to spread it, and that's all before any of this happened with the current administration. Yeah. So are there other things that you imagine that are giving you hope for what public media funding, support, encouragement, embrace could look like? Maybe not as a result of what's happening, but just because this discussion is a catalyst to change.
Yeah. Well, Jay, I'm naturally wired to kind of think that way, right? I always try to, I don't have any formal fundraising training. I'm a data geek at heart. I always like to kind of find new stories in data and try to transplant that into what can we do about fixing it, right? And that's another term for either advice about best practices or services or whatever. That's just my natural wiring, right? So I just think that I have, when we were starting a CDP 12 years ago, right? There was serious threat to audiences and change in broadcast models and everything else, right? Because people simply stop watching, or the decrease in audiences on traditional terrestrial networks, right? Kind of shifts to digital. And then you are in more competition with all the other media outlets, right? And I'm not saying that we figured it all out. That's still something that we're tackling, but we apply data and technology and solid approach to kind of finding new audiences on streaming and engaging people more in local communities, right? I mean, you could go back to, I don't know, 1970s or 80s. The invention of remote control was also a threat to public broadcasting because all of a sudden you had to get up and change the channel, right? You didn't have to get up anymore, right? So I just think about those as those are all things that are kind of in front of us. There are things we need to tackle, and I think it matters kind of how we stand up to it, right? Because I'd like to, like, yeah, we can sit in a corner and worry about the challenge that it is, right? And again, it is a serious challenge to public media, right? But I do believe in our ability to kind of work differently, look at data, right? And also I find it pretty inspiring when you actually talk to donors. I've done plenty of kind of one-on-one fundraising in my life, right? It's a pretty tremendous thing when somebody writes a check, right? And parts with their own money for the mission that you're representing, right? And that's, so we need to lean into that, right? So I don't like to think that, again, this is a very serious threat. It would really undermine a lot of public media service in many communities. It would change the way that public media is. But I don't, I I do think that we have a great track record and history, not just us as an organization, but as public media and as nonprofits as well, as really finding ingenuity in the moment and leaning into the community and rethinking about how we work, right?
So if you could maybe leave station leaders with one piece of advice on getting through this, what would it be?
Find a buddy. Work in groups. Don't go it alone, right? It's I'm gonna totally butcher it. I don't know how that saying is, right? If you want to go fast, go alone. If you want to go far, go together, right? And that to me is the point, right? If you can find a group of other public media organizations, and you know what, why just public media organizations, other nonprofits in your area, right? That you can work with and share and collaborate, right? I mean, those are things, those are shared resources that eventually lead to more mission, more impact on the community, right? So I don't think we don't need to have blinders on, just think that we need to work just with public media organizations, but there are other organizations in every market that have tremendous need right now to find resources, right? So yeah, I would say collaborate. And by collaborating means you don't always get 100% of what you want. There's a trade-off for that, right? So
Thank you so much for all of this, Michael.
yeah.
If people want to learn more about your work, about CDP, how can they do that?
Well, certainly cdpcommunity.org, LinkedIn, email me, call me, whatever. I'm always game for talking about fundraising and fundraising practices, right? And we have a lot of people in our company that are fired up about the same. So always ready to explore and learn from others, right? Because that's exactly how we grow.
Thank you so much, Michael. Great to see you,
Of
and
course.
enjoy
Great to
things
see
down
you.
there at the conference.
Thank you so much. See you.
Well, as we've just heard from Michael Heplick, public broadcasting is confronting an urgent funding crisis, but obviously there are solutions to every crisis. And one, in this case, that raises fundamental questions about the role of philanthropy in sustaining institutions that are serving the public good. But this challenge obviously is not unique to media. Across the globe, even essential institutions in health and humanitarian work are navigating new political and financial uncertainties. And that brings us to our next conversation, the role of philanthropy in global health, and what happens when geopolitics collides with humanitarian imperatives. At the center of this discussion is the World Health Organization, or WHO, the United Nations agency responsible for coordinating international health efforts, from pandemic response to vaccination campaigns to emergency care in conflict zones. In recent years, WHO has faced political headwinds, funding volatility, and increasing expectations from the global community. To strengthen its financial resilience and unlock new sources of support, the WHO Foundation was launched in 2020, right at the beginning of the pandemic. As an independent entity focusing on mobilizing philanthropic capital to support the mission of WHO, and its global partners. Joining us now in a pre-recorded interview to explore this evolving role of global health philanthropy are two key voices from the foundation. Anil Soni, the Chief Executive Officer of the WHO Foundation, who brings 2 decades of leadership in global health and development, having served in senior roles at the Global Fund and Clinton Health Access Initiative, and Bob Carter, founding board member of the WHO Foundation, and one of the most respected leaders in global fundraising, a former chair of the AFP, or Association of Fundraising Professionals, and a trusted advisor to major institutions worldwide. Bob brings a unique perspective on the bridge between global philanthropy and frontline health work. Here is our conversation with Anil Soni and Bob Carter. Jack? Hello to you both, and thank you very much for being here. I know this is a chance to learn more about the WHO Foundation, and you have 2 unique perspectives. Bob, I believe you've been on the founding board. Can you talk about the foundation and also how you came to start working with Anil as CEO?
Yeah, sure. Jay, thanks for having us on. Yeah, it was in 2019 when the WHO and through the office of Dr. Tedros, the Director General, wanted to examine the possibility of creating a private sector funding device, if you will, or portal to raise money from in the high net worth area in particular. That was the starting basis of this, versus the funding that WHO has enjoyed since 1948 of governments, participating members representing governments. There was a group put together from around the world. I served on that group, and we met for almost a year off and on. And at that time, it was around November or December of 2019, when we had a final meeting. We made a recommendation and we got a green light to go ahead with creating this foundation. I was one of the 3 founding members of the board at that time. And as you might imagine, we're creating a global foundation. We have 3 trustees. We were desperate for more trustees, more board members, I should say. And we also wanted to get out of the business of trying to run the foundation. Thus, we had a global search, and we were very fortunate that Anil Soni, who's with us today, was selected as CEO. And Anil came sometime around March, I think, maybe a little earlier, of 2020, arriving simultaneously with the pandemic, with COVID. And it was a wonderful time to start. And actually, it worked out pretty well to start at that time. So that in a nutshell, is how we got started.
Anil, how was this for you to join at the start of the first major global pandemic as we know it today for a century?
As Bob said, it's the right time. The World Health Organization, to understand the foundation, we have to make sure that you understand the World Health Organization, and the WHO is the World Health Organization. For 75 years, it's been where countries come together to respond to health emergencies and also to ensure access to the best available evidence and technologies to improve access to healthcare. But that first job of responding to health emergencies, WHO was on the front lines of COVID. And what we've learned over the last many decades is that healthcare can't be solved by governments alone. You need private partners, you need philanthropic resources. And the Director General of WHO, Dr. Tedros, has always had a broad, open tent approach. And particularly during the pandemic, when we wanted all hands on deck, it was an opportunity to invite more engagement. And the purpose of the foundation is to facilitate that engagement. Our job is to help philanthropists and partners engage, navigate, and give to WHO so that WHO can focus on the results and the work and the technical engagement and not on all of those other critical aspects of donor cultivation and conversion. So that's why we exist, and the pandemic was a perfect time to create us.
How is it that you, not you, but all of you, collectively decided that it was important to have this kind of private support? And the reason I ask is because this preceded the recent actions by the US government, which has been a key financier of the World Health Organization, to open the doors to private philanthropic support. Why? What was the genesis of that?
Well, maybe I'll start on that one. To note, private sector and philanthropic support to WHO is not new. The Gates Foundation, Bloomberg Philanthropies, Rockefeller, and others have supported WHO for a long time because they've recognized that the only way they can have the impact they wish to see in the world is through engines and vehicles such as WHO. So if you want to develop a new technology to eliminate a disease, you've got to make sure WHO is part of that package, part of that theory of change. And companies, particularly biopharmaceutical companies, have worked with WHO for a long time because likewise, they're critical to the profit and business of those companies. What I think we saw during COVID and at the genesis time of WHO Foundation, as Bob knows better than I do, was that there was an opportunity to broaden that tent. Actually, there was an opportunity to engage a lot more philanthropists, a lot more individuals, a lot more companies. And when you look at other international organizations such as UNICEF, a cousin of WHO, another UN agency, they have a great track record for that. But they've also put boots on the ground to do it. And so they have also spent many years developing those relationships. And that's where the foundation came in, is to further invest in those relationships.
And Bob, that brings up the point that, of course, there were already private funders of the efforts of the World Health Organization. So why was it so important to set up a separate foundation to do this? Many organizations and many individuals would say direct funding is the best way to get these jobs done. But this mechanism obviously has been fruitful. Why?
Well, along the lines of what Anil was talking about, it was an opportunity for expansion into that revenue stream. And the existing structure of WHO. And you have to remember the WHO itself, the mothership, if you will, was created in 1948 by the United Nations. My usual follow-up comment is what could go wrong. So it was heavily structured, and there really wasn't room for that kind of expansive thinking and the freedom of separate and aside organization, but supportive organization, to really spend 24/7 worrying about private sector funding. Many other functions come into play with WHO and so on. So I think it was recognized that because of the size of the market, and you asked the question earlier about why did we decide to do that? It was just that the scale and scope of the opportunity was too good not to get engaged in, and it was these kinds of the growth of billionaires in the world, in all parts of the world, has been just very significant. So the opportunity for broadening the revenue stream and increasing the revenue stream in that area was the right thing to do. And it's turned out and given what has happened now, it turns out that it was a very wise thing to do, because our foundation is not funded by any sort of municipal or public funds at all. We're a private sector entity, and that's the way we've remained. So I hope that's helpful.
You talked in a way about scaling, I guess, when you're talking about size and scope. So since you have founded it and now you're working together, how much has this grown as a result? How many funders are involved? What's the pot look like today as a result of this?
Well, it's grown. I'll let Anil address that more specifically, some of the metrics related to that.
Yeah, so in our first 4 years, we've mobilized $150 million. Last year was a critical one because the WHO did an investment round. They said, let's look at what we need to do over the next 4 years, how many lives we can save. So they were doing a campaign, as we call it, in fundraising and looking at saving 40 million lives by the end of 2028. As part of that campaign, as part of that 4-year scope of work, we raised $50 million last year alone, including 16 new institutional donors. And on the individual giving side, we've raised single-digit millions, but engaged tens of thousands of people, which is a much larger audience of individual givers than WHO's ever had. This year, we're trying to do it again, despite a really challenging environment, and raise as much as we did last year or more, and then move from raising tens of millions, 50 million again last year, to the goal is 100 million annually in the years ahead.
You just said the challenges right now before us, and there are many. So we tend here in the U.S., where I'm sitting, to be thinking about what the U.S. government's doing, which is not far, about 25 miles from where I'm sitting. But that's not the only economic pressure on the UN generally, or maybe WHO specifically. So just to make sure we touch these points, I understand that the funding under the current administration, U.S. administration, has been cut to WHO, but that may not be an isolated incident. I know that other governments are also having to recalibrate their spending. What kinds of pressures are existing globally on the WHO, and how can the WHO Foundation then make adjustments to try and adjust for that reality?
So we've experienced a renaissance in global health and development over the last 20, 25 years. We have reached a level of annual funding that we couldn't have guessed we would have reached back when we started. But that level has peaked, and we've now come down from that peak, and I don't think we're going to go back. Part of the reason is the United States government. Under the current administration, choices have been made to pull back on foreign assistance. That includes, but is not limited to, the World Health Organization. But in the case of WHO, it means $500 million less per year. And that's a chunk of change for WHO. Other donors have had to adapt and also have their own political pressures. So for example, the UK has announced it's going to reduce its foreign assistance by 40%. What that means, first and foremost, for WHO, because you have to invest in an entity and leadership, and what are they doing about it? And what that's mean for WHO is reducing its budget. So financial responsibility, reducing its budget by 20%, prioritizing and making sure the work that it does this year and in years ahead is having highest impact and operating from the funds available. There's certainly not a low need. In fact, the reductions in aid mean that the need has never been higher, but we have to be thoughtful and efficient and innovative about how we meet those needs. For the WHO Foundation, our job has never been more important, and we're engaging philanthropies and companies in two ways. One, we're saying, how do we make sure we're providing funds to bridge this transition year? Because even if you get to a lower budget next year, this year you have financial shocks, you have less money, and you have the cost of cuts. To bridge from where we were to where we're going, we need support. And that means engaging philanthropists and companies and saying, there are programs you count on, you believe in, you depend on in terms of your own business, asking for help to make sure that those can be maintained. But importantly, we have to be bridging to the future and not just be focused on the past. So where's our anchor? We are not going to recreate the programs of the past. We really need to be looking to the future. And so a lot of our engagement with philanthropies and companies is saying, how do we imagine WHO as a platform for innovation and impact in the future so that we're deepening the relationship to dream big together, even through this period of transition?
Bob, I'd like to ask you about that. The idea of an entity dreaming big now is both welcome, but many people are skeptical. There's been an erosion of trust generally about everything from government to nonprofits, and this is not just true for individual donors who are giving $25 a month to their favorite charity. It's also true for the large donors. So they've really come to the fore, but there's increased pressure on them to do more. If the WHO, which is of course connected to the UN's general efforts, seems to be saying, help us. Are you seeing that greeted with open arms, skepticism, or some combination of the two?
Well, I have to give you one of my favorite quotes over the years, which is, no skeptic ever built a cathedral. And there are lots of them out there, but it just doesn't happen. The good news is there are many people who are seeing this as an opportunity to refinance global healthcare and to take a look at it. And sometimes we call it in our business the interruption process. But we didn't ask for this, but we got it. This was some kind of an intervention type thing that says, let's rethink this. If we were doing WHO over again, how would we fund it? How would we finance it? And it would definitely not be 100% government funding. It would be some sort of combination of finance. And so that reimagination, I think, and this in philanthropy, people do give to the future. They really don't give to the past. So the new idea concept is one that I think is taking hold. The WHO and WHO Foundation are forced, if you will, to take a look at how we do business and how we engage, and inviting people in and saying, come grow with us now. We are slimmer. We are perhaps more cost effective as a result of some of that. And your investment is going to be stewarded and watched in a way that it never could be before in a lot of ways. So I think there's a good response that's happening, and Anil has some recent evidence of people, wanting to join in. So
Yeah, can I give you an example, Jay? So
Please.
both the how do we bridge, but also how do we dream big. So one of the programs affected by the reduction in U.S. funding is nicknamed Gremlin, or that's the acronym. It's the Global Measles and Rubella Laboratory Network. And your listeners might say, you've lost me already. But essentially, it's the front line of surveillance for measles and rubella. And measles is the most contagious and most deadly pathogen that's vaccine preventable, but we've seen vaccine rates go down. So what that means is we need to know when there's a measles outbreak so that we can respond. It's a network of 800 labs across nearly 200 countries, and WHO runs it and historically was funded by the CDC. Keeping that lab network going in a year in which we're having outbreaks is critical. The Elma Philanthropies and now some additional foundations have agreed to fund that at the single-digit million level. That's great. It's going to keep the lights on. But the question is, what do we do in the future? And the Gates Foundation has actually said, this isn't just a program that we want to keep running. We want to build on this. Why is it only looking at measles and rubella? Why don't we break down the silos and make sure that a lab network that's working has as many pathogens on it as possible? I was in Singapore last week and a philanthropist said, this sounds great, but can I give you some connections to logistics providers so that we can help you on that? I was in Abu Dhabi the previous week. I've been on the road. And what I heard there was, this sounds great, and we have some innovative technologies that might be able to make your surveillance process that much more efficient. So do we need money to get through this year? Yes. But in the future, that's actually a platform that we can dream big on, both through funding, but also through those partnerships.
And it sounds like you have the flexibility to do that because as an independent foundation supporting the WHO's work, you can build those bridges. What is the financial goal? That's something that fundraisers always want to know. And you talked about the metrics of where you want to have that impact, and that's very important. But what's the financial goal? You're at 150, I think you said. So where do you wish to be?
This year, my target, as Bob, as my board member knows, is $60 million. So I want to raise $60 million by December 31st to be used this year and over the subsequent few years, both to meet these immediate challenges, but also to lay investments for that impact in the future.
And do you have an endowment goal as well, Bob? Or is there something where you're trying to build a corpus to address the emergencies that arise that these, the current budget can't completely address?
We would love to be in a position to raise more endowment money. I mean, that was, a dream would be to raise at a minimum a sufficient endowment to create core funding so that our operations are guaranteed, et cetera. We're still raising money to run the foundation. And that's the startup concept. We're several years old, but we're still to some degree in a startup mode. So, Anil, there's no lid on 60 million. If we can raise more money, we absolutely will. And we started out with wanting, a 5 to 7 year ambitious goal of $1 billion. We've done some resetting on that with the reality that we have to deal with. But I think that as we look over a decade, we're going to be in that kind of a league ultimately. This campaign that we have involving more and more individuals, there are some very significant possibilities through that of estate planning and those kinds of things, which WHO has never really done effectively at all. Let me go back just a second, then I'll be quiet. But I think one of the important messages is that so many people, and I'll speak particularly in the USA, don't understand what the WHO does. And I'm asked very often, what do they do? And I say, well, they do so many things that stop disease from landing on your doorstep that you don't know about. It's the eyes and ears on the globe, addressing health issues before they arrive at your front door. And it's taken for granted that, we'll be safe. I think the COVID destroyed some of that image, but we still feel pretty entitled to be healthy, if you will. Understanding that the CDC, in collaboration with WHO, the CDC relies very heavily on WHO. And that's a great partnership and relationship. And the degree to which we damage, if you will, the capacity of WHO to do its work, the CDC will be less effective. And that's our best guard in many ways against these kinds of things. So the more people we can talk to about how important it is, even though you're not feeling you don't think you're feeling the impact of WHO every day, you actually are on your own doorstep. And that's the reality of this. No one else in the world does what WHO does that I've run into in all my years, and I have a few. So
well, I know that we have to wrap this up now, but people will definitely want to know how they can be supportive of this effort. So, Anil, maybe I can leave that with you. How can people reach out and learn more about the work and support it?
Thank you, Jay. I appreciate that. For those who are listening who want to help, we welcome your engagement. You can donate directly, or you can contact us through our website, which is who.foundation.
Thank you both very much. Appreciate it. Our thanks again to Anil Soni and Bob Carter. And to learn more about or support the WHO Foundation, as you just heard, you can do that online. You can also learn more about Bob Carter and his work through his interview on the PM podcast. Coming up next in the Philanthropy Mastermind series, out now on the podcast, we've kicked off a special 6-part series recorded live at AFP Icon in Seattle. Our first drop there was Jeremy Wells, recipient of AFP's 2025 Outstanding Fundraising Professional Award. The next one is with Dr. Jen Shang, and it's a conversation on love and philanthropy. You'll love both of those, and you can hear them wherever you like to listen to podcasts. They're also interspersed with other conversations with thought leaders in the space, including this week's episode with Jeff Schreifels of Veritas. Once again, listen on Apple, Spotify, Podbean, or over on the DonorSearch YouTube channel. Next Thursday on How to Raise, our sister show, we return with Beyond the Ask, Cultivating a Fundraising Ecosystem with Aloha, featuring Jennifer Oyer, founder and chief joy officer of Community Impact Advisors. She'll explore how to build a resilient fundraising strategy rooted in authentic relationships, community-centered philanthropy, and joyful engagement. Learn to move beyond transactional giving to create a thriving, sustainable ecosystem. You can do all that. Once again, that's next Thursday at 1 p.m. Eastern Time. To register for these and all of our upcoming sessions, visit the website of our sponsor, the enormously generous DonorSearch, the leader in responsible AI and donor research solutions for the nonprofit fundraising world. You can find all that content at DonorSearch.net under the Resources tab. You can also sign up to be on our list to learn about all the future programs in this series. And while you're there, you can learn a lot about the donors who make your work possible. Again, that's at DonorSearch.net. So we thank you for being here today. We look forward to seeing you next time. Till then, take care.